Okay.
The forearm pronators and supinators are important for everyday function. They allow the body to flip the hand either palm up or palm down. This gives someone the ability to perform tasks such as turning a doorknob without having to rotate the rest of your arm and your shoulder. The line of pull for the supinator starts with the origin at the lateral epicondyle and proximal radius. The insertion is located at the neck and shaft of the radius. The line of pull for the pronator starts with the origin at the medial epicondyle and the medial border of the coronoid process of the ulna. The insertion is located at the mid-shaft of the radius. Our first exercise that targets the supinators and pronators is considered to be a low-level exercise. This exercise is done with the patient lying on their back with their elbow at 90 degrees. The patient then rotates their forearm towards and away from the body. This is done in a gravity-eliminated position. If the patient is able to perform the full range of motion for supination and pronation in this position, it indicates they have a muscle strength grade of at least 2 out of 5. For an intermediate level exercise in our first exercise set, we will have the patient perform an isometric contraction of supination and then pronation. This should be performed in a seated position with the elbow at 90 degrees. The patient starts with the forearm in neutral and then resists either a stationary wall or a manual resistance given by a therapist. As the therapist, make sure you stabilize the proximal forearm. This exercise is good to use in the early phase of a rehab program because there is very little motion occurring at the joint. Perform this for 3 sets of 10 seconds of resistance. You may increase the amount of time the contraction is held to progress this exercise. For a high-level exercise in our first exercise set, we will have the patient perform supination and pronation with a dumbbell in their hand. Start with a 1 to 2 pound weight and increase the weight up to 5 pounds to progress the difficulty. This exercise should be performed in sitting with the elbow stabilized and the forearm hanging off the end. This causes the muscles to perform concentric and eccentric contractions. In this position, the patient is performing the exercise against gravity, indicating they have a muscle strength grade of at least 3 out of 5 with no weight and 4 out of 5 with weight. The suggested prescription for this exercise is 3 sets of 15 repetitions, but can be altered on a patient-to-patient basis.
Yeah.
The second set of exercises that targets the pronators and supinators can be used for patients who are somewhat advanced or later in the rehab program. The first exercise is considered to be a low-level exercise. We will start with the patient holding a screwdriver in the involved hand and have them tighten and then loosen a screw almost all the way. This exercise extends the length of the arm and gives the patient a small amount of resistance. Use the screwdriver to screw and unscrew a total of 5 times with 1 minute rest in between each. The intermediate level exercise in our second exercise set involves the use of a hammer. In a seated position with the elbow stabilized and the forearm hanging off of the table, grip the handle end of the hammer and place the forearm in a neutral position. Have the patient perform supination and pronation slowly. This motion resists concentric and eccentric motions for both actions. This exercise extends the moment arm of the weight and also increases the effect of gravity. If this exercise is too difficult to start, the patient can choke up on the hammer, which will decrease the moment arm of the hammer. This suggested prescription for this exercise is 3 sets of 15 repetitions, but can be altered on a patient-to-patient basis. Going back and forth each way is equivalent to 1 rep. The high-level exercise in our second exercise set involves the use of a golf club. In a standing position, the patient will hold the club in one hand, slightly extended out in front of them. The patient will perform pronation and supination, minimizing excessive flexion and extension motion at the wrist. This exercise focuses on both concentric and eccentric contractions. It also extends the moment arm even further and increases the effects of gravity. The suggested prescription for this exercise is 3 sets of 15 repetitions, but can be altered on a patient-to-patient basis. Going back and forth each way is equivalent to 1 rep.